All right, so I'll introduce myself. I'm Kyle Armstrong, Multicultural Communication Specialist at MCI, the Multicultural Coalition, Inc. As we announced before, I will be taking these over from the lovely Gina. Let's see here. Today, we are so honored to have Sheng from Us Too Behavioral Healthcare presenting, and we will get to that after a few small things. So the first up is kind of something that we haven't done recently, but we're going to do today, which is a little survey. We want to get some feedback from you all first. And so what I want you to do, for those online and in person, you can scan that QR code, or you can go to this link here, and I will put that in the chat as well. Please do that right now. I've got a captive audience, and I'm going to make you do it right now. And so a little context about the survey. We are always exploring ways to improve our events. And so the MCC now, after going on for 3 years, we're just exploring ways to change the format potentially. And so we want some of your input on that. We have in the past done on-site MCC events at different organizations. We are looking at doing more of those. We're also exploring doing workshops in these times, or having like nonprofit resource fairs where folks like you would be able to set up a booth, and we could just kind of meet each other, mingle, share materials and the like. Yeah. Okay. So I will move on from that, but just know that we really appreciate your feedback. And yeah, if you'd like to wait till afterwards, totally fine. All right, just quickly, some upcoming MCI events. We have 3 of our famous free health and resource events coming up. The first is going to be at the Menasha Public Library on March 6th, and that one will be from 4 to 7 p.m. We've already got, I think, 20 nonprofits ready to present, have a little booth there. And just a little background, our free health and resource events are designed to be barrier-free for the folks that we're serving in the community. We try to have on-site as much as possible to distribute, whether that be diapers, whether that be just literature and resource information. And we like to, at this one, actually all 3 of these, we are going to have free, no questions asked, no insurance, no ID COVID vaccines. And move that way, we can't see. Sorry, oh, the camera's not even on.
Yes, it is.
Oh, okay.
So Kyle, the first 2 have vaccinations?
All 3 have vaccinations.
For any age?
For 12 and up.
12 and up. Okay.
Yep, so all 3 have COVID vaccinations for ages 12 and up. All right.
And what time do you do? What time?
The Menasha event is going to be from 4 to 7 p.m. The Chilton event will be from 5 to 7 p.m. And the Oshkosh event will also be from 1 to 4. And with that, we have a small business spotlight presenter today. And we are so lucky to have beautiful Braids Studio in the house. So if you'd like to stand up, introduce yourself. Get right in front of the screen so we can all see you. We want people online to be able to see.
Well, hello, everybody.
You're good there.
I know this like. I'm Kiona, and I am one of the owners of beautiful Braids Studio. It is actually located in Menasha, Wisconsin. And so my husband and I own that. We opened it around March 20th. We established business around March 20th, and we opened the doors in August of 2022. There was a year or 2 gap. I wanted to first get my cosmetology license through Fox Valley Tech. I graduated in August 2021. And then I wanted to make sure that I have all the curriculars well, all the establishment, all the license that I need for my business. So that is why we open around August 2022. I'm getting nervous, I got it.
You're doing great.
All right, I'm gonna just use the screen. All right, so hey there, my name is Kiona, and my husband and I are owners of Beautiful Braids Studio. It's a small salon business based out of Menasha, Wisconsin. As I mentioned earlier, we established it in March 2020, and we opened to the community on August 1st of 2022. So the vision of Beautiful Braids Studio is to enhance the beauty of curly hair, coily hair, kinky hair, wavy hair, straight hair types. Beautiful Braids Studio initially started as a service-based business to provide an area of service for my clients. That's why I opened it, because I had a lot of friends and family just kept giving me so many people. I'm like, oh my God, okay. So it all started with them. So I am offering hair braiding services, hair extensions, hair styling, hair cutting, hair coloring for everybody. No discrimination at all. As I mentioned earlier, I am a cosmetologist, and this year I will be becoming a salon educator through the Gateway Tech College. They offer online cosmetology program, cosmetology instructor program. They don't have it here at Fox Valley, but if you have any aspiring cosmetology who wants to pursue their career, Gateway Tech has a program. There's one active now, but there will be another one coming this fall. And then I just wanted to teach others by providing fresh and natural hair answers to their questions. I want to continue to, I messed up. I was doing all this last night. So I am sorry. It was pretty at first, but then I went crazy.
It still is pretty.
So without looking at that, link to PDF export. But I just wanted to be an add-on person, be an add-on place for those who just want help with their hair, want help with with their hair. It's right now, People Progression, I just learned they're having a Fox, their first Black Expo Center this Saturday. That is great. So next year you will see me on there. But it's just good to see that how we all are working together to help close the hair equity gap. So that is it, guys.
Are you working with African refugees?
No, but if you have a
That's wide
connection.
open.
So this is my first time. I've been in the area for a year. So this is me stepping out to all of you guys to let you know I'm here. I wanted to help, I wanted to serve. So if you have any organizations or schools, anything, just let me know. I am more than happy to go and offer my service or even just teach. So this is just my first step, yes.
Kyle, can you back up one screen for me, please?
So my question is, do you provide service for individuals that want to learn what their hair texture is? Like if it's a 1 or 2 or 3 or 4, just because I know that that's something that a lot of people struggle with is like getting the right product for that textured hair. And it's so many products out there, and trying to figure out which one works best is like impossible. And it's expensive, right?
Mm-hmm.
Yeah.
Yes, so I do, which is why I have those one-on-ones. So this is a salon business, but it's still a studio, so it's based on one person at a time, right? It could be a student, it can be someone in the community that need my service. It is my due diligence to make sure that I am educating them about their hair, from the texture to the actual products to how to sustain it for a long time. So this is not something where you're just getting a style. This
Okay.
is something where you can educate us, because I want to empower you to continue to take care of your hair, right? And then you can help me share share all of that. So yes.
No, please, go ahead, Jackie.
And tell you what you were saying.
Yeah.
So basically, I know one thing, I find myself having to always go out to Milwaukee to get what I need for my hair because the lack thereof products here, but like you're saying, it's so expensive, I can't be playing around like, this might work, you know? So yeah, so we also, you know, even, what's that, how can I say it? Are you selling the product and can we get the product through you based on whatever the need is?
Right now, I am working on the vendor because I'm very selective. I don't want to just have anything and everything. I have been doing my research, making sure that the products I do sell in the salon, that is not on the shelves at Sephora, not on the shelves at, it has to be unique. So that means I have to go out and talk to other Black-owned businesses that's willing to partner with me in selling those products. But it's still my job to educate you how to use it and why. Now, I'm not gonna be saying, hey, you need to be using this product. It's based on your hair texture. I can't just sell you Shea Moisture.
Right.
It's not gonna work for you.
Yeah.
Or I can't, you know, we have to talk through it, which is also why I have free hair consultations. When you don't know, just make an appointment. You got 30 minutes of my time and you can ask whatever you want.
That's great. Cause I know as age, you know, if your hair changes and I just hit over a certain age, I'm like, this is not the same hair I had 2 years ago. So I love that input. So thank
And I'll
you.
be on your hair journey, so I won't be alone. You won't be alone.
Tell us how to get in touch with you.
I'm sorry?
How do we get in touch with you?
Oh,
How to book an appointment?
I have a whole lot of calls.
Oh, yeah.
I just pass it around.
I can take a picture and put it in the chat too.
yes.
Yep.
Do you know Bola?
I'm sorry?
Do you know Bola, the professor from St. Norbert? She's from, who knows Bola?
I do.
Yeah.
African Heritage.
Yeah.
She works with African Heritage. Inc. It's a nonprofit in this area that helps individuals of African descent and the whole diaspora with different programming in the community. They usually do the Juneteenth event, back to school events and stuff like that. Yeah,
That's why I'm here, because I need to know, all of that so I can just.
They're connected to that event that you just mentioned that's happening here over the weekend. They're connected to
The
it.
Afro Hair Fair.
Okay.
Yeah.
Okay.
Thank you.
Okay, before we turn it over to Sheng, I just wanna make a last push for food, grab more food. We got lots of wonderful, tasty stuff from Cozy Corner. And I think with that, yes, we're gonna turn it over to Sheng, so let me just pull up this one.
I'm gonna introduce
Oh, that's
Sheng.
right.
Sarah. So. Sheng, you can come up with me. I get the privilege of introducing our speaker today, and with us we have a first generation Hmong refugee, Sheng Yang. She was resettled in Wisconsin as a young refugee to become a licensed clinical social worker and a perinatal mental health therapist. Her background as a former professor teaching social justice issues, mental health, and advocacy to social work students highlights her commitment to educating the next generation of social workers and mental health professionals about the importance of these critical topics. Opening Us to Behavioral Health in 2019 has reflected Sheng's vision of creating a space where everyone can work towards better mental health together. Her personal and professional journey is a testament to her commitment to making a positive impact in the lives of individuals and families in our community. She is also the proud mother of 2 young children, and that adds an additional layer of perspective and empathy to her work, highlighting the importance of family and community in the context of mental health and well-being. So please give a warm welcome and a chat applause to Sheng. Thank you.
All right, thanks for that warm welcome, Sarah. Just full disclosure, I do not write my own bio, I think it's weird. And so I just say, okay, this is who I am, and somebody packages up nicely. I'm like, oh, That sounds like an interesting person. So as Sarah mentioned, my name is Sheng. I am founder and executive director for Us Too. I'm going to spend the first maybe portion talking about who we are as an organization. And then I'll talk about, kind of culture, really, how does that impact us as individuals, right? So, all right, so who is Us Too, right? It's very short for Us Too Behavioral Healthcare. Our mission is up here. Really, we are here to advance health equity, and then with the vision that we can all be healthier together. I will just put a little bit of history for Us Too, that we had this genius idea to open doors September 2019, so 6 months pre-COVID. Right. My husband, my partner, he actually quit his full-time job, and then I went and took a huge pay cut and made $50,000, and we both volunteered for Us Too, really to bring our community forward, right? So September 2019, we were talking to donors, we were talking to funders, we were talking about health equity, we were talking about diversity, equity, and inclusion. Months before the murder of George Floyd, and people were telling us, we don't need this in our community. It is not a problem in our community. And I said, you probably are living under a rock, but okay. I'm the kind of person that takes no, and I will weaponize it to make something out of it. So, a lot of myths about Us Too. We are a minority-only clinic. Not true. Actually, 75 to 80% of our clientele is actually from the white Caucasian background. We only serve low-income individuals. Again, not true. We actually serve individuals from all socioeconomic statuses. 75 to 80% of our clientele, though, are low socioeconomic, because unlike other organizations where they will have a quota on Medicaid and Medicare recipients, with everyone having a wait list right now for mental health care, we will actually prioritize individuals who are on a sliding scale because they can't afford it, and or Medicaid, Medicare individuals. That is our mission, that is our commitment, and that is our way to give back to our community. And then the last one is, we only service individuals in the Fox Valley. That's also a myth. Truth is, we actually service all of Wisconsin, because we are a trilingual organization. We serve individuals who are, or who identify as LGBTQ, and because we are a culture first emphasis organization, we have a statewide reach. And also because we are one of the few organizations that serve perinatal mental health, right? So mothers and children, with an emphasis on fatherhood engagement, because we know that our Black and brown fathers are oftentimes put in prison and in jail so that they can't be fathers to their own children. We have a lot of referrals from the Madison and Milwaukee area. There's a fun picture of my partner and I. All right, so what is our approach? What makes us so unique? Because when we opened up, all we heard was diversity, equity, inclusion is not needed here in the Fox cities. We don't need more mental health clinics. We have an overflux or influx of them. What has really made us successful is really our approach, right? So as I mentioned, we focus on culture first. And culture means a lot of different things to a lot of different people. But when I say culture, white people often think about us and them. Because white people don't realize that they also have a culture. It's white culture, right? And I love asking that question of my clients who are 75 to 80% white, because it gives them an opportunity to actually identify themselves outside of what they think they're supposed to be in a white culture as well. We heal from a holistic perspective, really building resilience based on that person's culture and what they see as healing. Recognizing that every culture and every individual has very different help-seeking behaviors. Security and safety are universal concepts. Doesn't matter where you're from, how old you are, what country you're from, what language you speak, those are universal concepts. How it is provided in a therapeutic setting is different. And really, that's because we want to empower individuals to be the experts of their own lives. I'm here to guide you. I'm here to walk you through whatever path you're going down. I am not here to hold your hand. I am not here to do it for you. If you want to heal, you have to take ownership of it. So a little bit about our counseling program. So right up here, we are one of the few organizations that do offer dialectical behavioral therapy. In short, it's DBT. Most often individuals will utilize DBT skills, but not necessarily trained in a full curriculum or offering it to the way that it's supposed to with fidelity and research. And I emphasize on DBT because the way that we run it at Us to Behavioral Health Care is that it is very intense. It's for individuals who are often seen as criminals and individuals who are often seen in probation and parole. We already know what that demographics look like. It is 26 weeks long. It is intense. We've ran 4 cohorts. And to date, we've had 100% reduction in returning to jail. 100% reduction in hospitalization. 75% reported improved interpersonal skills and relationship skills. 75% reported feeling better about themselves. And the best part, or the best one for me, was when someone said they actually found a way to make space for themselves. So that's our DBT program. We also have the perinatal mental health program, as I mentioned, and so this program really focuses on from conception all the way to about when the child and the baby is about 2 years old. Most programs for perinatal and maternal mental health really focuses on the mother. We focus on the child and also the father as well, and teaching fathers how to engage with their children, right? How to be a father, because oftentimes we have an emphasis on moms and programs for mom and different services for moms, so then we kind of forget about the dads. Knowing though that 10% of fathers actually experience postpartum depression as well. And that's probably low. We have our parent support groups. This group is for individuals who has a child or adolescent who identifies on the spectrum. What we were finding with the work that we do is that parents were really saying, I want to support my child, but I don't know how to. Right, I want to support my child or my children, but that also comes with a loss for me and a loss for my identity, because maybe I thought I had a daughter, but now I have a son, and it could be a loss of identity in the sense that they lose their social supports, they lose their religion, they may lose family members and grandparents. And so this parent support group is really to support parents and caretakers of individuals who has a child on the LGBTQ spectrum. We provide school-based counseling services. We cover all of Nina School District and then 8 of the Appleton Elementary Schools. And then the last one is the Girl Power Group. This is our first pilot with high school girls, and so ages 14 to about 17. And so far, it's been such a fun group to really see these girls, right? These young girls and adolescents really come out of their shell and talk about issues that they're experiencing with self-esteem, relationships, transitional periods in their lives when, maybe they're 17 years old and they're in high school, or they're in high school and they're junior and seniors. And so this Girl Power Group is really to support our young girls, right? And helping them find a voice for themselves in the community.
Are you connected to the STAR program at all?
No, we're
For the
not.
African American kids?
Not specifically the STAR program, but as an organization, we do a lot of work with Boys and Girls Club.
Great, okay,
Yeah.
super.
And then when my partner and I founded Us2, we said, you know what, we know there's a health equity issue in our community. Again, this is pre-COVID, this is pre-George Floyd, before a lot of people thought it was fun to get on that bandwagon, even though a lot of those folks have jumped off the bandwagon. This is 4 years later. We said, we cannot be the only ones doing this work. And so part of Us2 is that we will support organizations in the community and also becoming inclusive within their own organizations. And so that's where the consulting and training side of Us2 comes in. We provide trainings and workshops. We really try to support organizations with cultural transformation. We can come in and help you do your organizational assessments, and then also your IDI assessments. IDI assessment is a 50-point scale assessment that an administrator has to go through a whole course and be certified to administer the assessments. The assessment will essentially tell you what is your perception in terms of, EDI, being inclusive, your biases. It'll give you your score based on your perception and your actual. And what I like about the IDI is that it doesn't shame anybody about where they're at with their journey. It doesn't say, this is where you're at, you suck, but it'll say, here's your gap, right? Here's your gap, and here are tangible action items and how we close that gap, right? Because anytime I want to take an assessment or I do take an assessment, it's like, okay, this is how I scored, but what's next, right? How do I move the needle forward? Some of the coolest things about our training and consulting is that we've trained about 4,500 people across the state so far. We are in the process of getting nationally certified. And many folks think that we as an organization only train human services organizations, mental health organizations, maybe other social workers, because I'm a social worker by trade. That's not true at all. We partnered with a lot of different disciplines. When we think about health equity, right? Who and what systems impact health equity? And so we train engineers for several years in a row now, thinking about, okay, if you're a civil engineer, a mechanical engineer, you need to understand that the products that you choose to use or where you choose to dump or where you choose to build has an impact on certain groups of people. We train lawyers, we train judges, we've gone to Madison, train folks in the judicial system. And so we are really proud about the work that we've done within training and consulting and making sure that people even have the slightest awareness, right? So planting that seed. All right, so why, right? People always ask me, well, why did you start us too? Because it's about our community health. If we're not concerned about our community's health, right, we're really forgetting about our children, future generations. It's about investing in the future of our community, particularly the Fox cities here. As Sarah mentioned in my bio, I was born and raised in Thailand and in refugee camp, but we've resettled to Appleton, and Appleton has been home to us. And it's going to continue to be home to me, I hope, right? And my children as well, but I'll let them make that decision when they get older. But really, a community where I can grow in, that I'm proud to grow up in, right? And in a community where my children can thrive. So let's talk about culture though, right? I talked about culture, us too as an organization, really focusing on culture. Oftentimes we think about culture from the individual level, but there's also organizational culture, industry culture, and even national culture. If I was to ask you right now, tell me about your culture, what would you say? Could you describe that quickly? As a therapist, one of the questions on our assessments is always, what is your culture? You ask everybody this, it's required. Every time, I should say every time, 99.9% of the time. When I ask BIPOC folks this question, they spit it out, right? When I ask white people this question, they look at me, they say, well, I'm white. Yes, I can see that. Your culture, right? But it's so important for us to really learn who we are at an individual level about culture, because it defines our values, it defines our morals. It actually defines how we're socially conditioned to believe certain things, which impacts our behaviors, our biases, our microaggressions, how we treat people. How would you describe the national culture right now? Okay. Divided, what was it? Trouble.
Overwhelmed and confused.
Overwhelmed and confused. Okay. Would we say that the national culture or our national culture has an impact on us individually? Think about that. How does culture manifest? Well, I like this iceberg, right? Usually we think of culture as, language and art and how people dress, or maybe things that are tangible or celebrations, but really the subjective culture is the most important things that we need to know about culture at all. Our way of life, our values, our attitudes, social roles, religion, communication. Do you think any of the subjective culture within the United States is really tangible, or we just kind of know that's how we operate? How would you describe communication here in the United States?
What communication?
Depending on who you're talking to in the generation, right? I just learned what goat means, so that tells you how old I am. Our communication here in the US is so quick. We literally have a word for everything. And as somebody who has done a lot of translation in the past, I'm like, wait, hold on. There's only one word for that. I don't even know the word purple anymore. But it's also very militaristic. Think about it. Execution, right? When are we gonna execute that? Bottom of the totem pole. Trigger. Where does that culture come from? And have we even realized that before about the way we communicate? As I mentioned, all of these things lead to our biases and microaggressions. But I ask us about culture because our culture here in the United States and in Appleton, Wisconsin, and Fox Cities, racism is so subtle. It is culture to us. It's in the air that we breathe. We all bleed red, right? But we still can't stand each other. We've learned how to put man on the moon, but we can't learn to love each other. Culture and racism are intersected. That is the culture of the United States. And that is what breeds white supremacy culture. And that is how we continue to have generations of white supremacy. White supremacy is the biggest threat to people who are not white, who are not cisgender. White supremacy is the biggest threat to health equity. And if you don't believe it, you have to follow the research. Only 30% of someone's life choices actually impacts their quality of life and how long they live. 70% comes from policies that people like me and Black and brown bodies usually have no choice, no power, no control over. 70% comes from access to quality health care and education, where Black and brown bodies and people who look like me have no control over. We just saw that in Green Bay. 70% comes from waste, or where people choose to put waste in living conditions where Black and brown bodies have no choice over. Racism and hate is culture, and it breeds generations of white supremacy. It is the start of America with the genocide of indigenous people for the purposes of economic wealth. In a country that thrives on capitalism, and if we continue that way, we will continue to have white supremacy. You think about how Black and brown bodies were brought here. The genocide of the indigenous people was just the start. You think about slavery, and then when slavery was apparently abolished, the Chinese immigrants brought here for cheap labor. And then we use white supremacy to pit Black and brown bodies against each other. Because Black African American slaves were not allowed to be paid for their work, but Chinese workers were for pennies. So when I say come here today to talk about culture, if there's anything that you take away today is recognizing that racism and hate is culture. We are all racist people. I am myself. Every day I have to flex that executive functioning part of my brain to question myself when I see something that I think is off, right? We're here to help. We're here to have these tough conversations. You know, I'm a believer that we can have conflict, we can have tough conversations, and that is the only way that we heal. I don't know everyone. I know myself. I know my culture. I know where I stand, but I invite people to teach me differently, to teach me better. And I hope all of you can really take that information and also do the same thing, right? Thank you.
Thank you so much, Sheng. Actually, you can take questions either seated or standing up. If you want to.
If you want to throw tomatoes at me, throw that. Yes.
I just want to start with a quick apology to both you as our speaker and everybody else. There was just a slight mishap with the room things going on this morning. And so we would have typically had a microphone. And so I realized that there's a party going on next door, which we were meant to be. So while the topic was serious and you shared a lot of great things, I just want to apologize. I hope the noise we heard didn't take away. So I just wanted to extend to everybody and you apologies, but we still very much appreciate you being here. Thank you.
I hope they heard our conversation.
I hope so too.
There's other forms of discrimination, ageism,
Yes.
very definitely, particularly with women.
Absolutely.
Prisoners,
Yes.
Wisconsin prison system has almost 50% African Americans because our laws in the state suck. And there's different kinds of discrimination. And some of you have more kinds against you. You're a woman, you're an Asian woman. You're a small Asian woman.
Until I open my mouth.
You're an educated now. So, yeah, so you deal with a lot of different things. And thank you for putting the white supremacy up there, because when 40% of the Appleton public schools are minority students, and most of the people in Appleton have no idea what's going on out there. Most of them. I've been at this for too many years. I'm 81. And this has been going on for too long. So keep up with your good work.
Thank you.
Thank you, Rana.
Yeah.
Okay. Is the parent support group offered in person or virtually?
Yes, yeah, usually it's in person. We try not to do hybrid or virtual, but sometimes, you know, people get sick or there's snowstorms, so we give them options too. But yes, it is an open group as well. People will have to get an assessment done first, just to make sure that, you know, they are, you know, maybe they need one-on-one counseling first, and or maybe, you know, that's just not appropriate for their group. So we just ask they have to go through at least one assessment.
Okay, thank you.
Could we actually go back to that slide? I was trying to remember which program I was gonna ask some questions on.
Well, keep going.
I think it's counseling maybe?
Yep, there we go. The group that you're talking about, the maternal and child health.
Yeah.
Can you explain like how that works and what that all entails?
Yeah, so it's part of counseling. It's part of counseling, but then really the emphasis on mothers, right, and parents. And so we go through looking at, okay, what are your life transitions? What are your stressors? Right? Also, a lot of times it's, you know, baby blues, postpartum depression. We see a lot of marital or relationship issues too, right? Because if you're, you know, let's say, a couple, right? And then now you brought this baby home, it's exciting. And then also it's like, what? This thing doesn't sleep, right? And it's these role transitions that doesn't really set most people up for, you know, like understanding the reality of it. But the other piece too is destigmatizing, right? And acknowledging the true experiences of Black and brown people who go through this period of life with, you know, bringing a new child into the home, right? Because we know divorce rates are highest after a baby comes into the home. We know that a lot of our Black and brown dads don't get that experience to actually be a parent when their child maybe is young because they were incarcerated and now they're out. And so it's, you know, giving them that opportunity to experience it, but also be raw and real about, hey, this is how I feel. Like, I feel bad that sometimes I wish my child would go away. Doesn't mean I want to get rid of them, but at the time, it's that space of like, yeah, that's true. It's valid, right? You're going through these life transitions or these transitional roles within each other and your family.
So would that be like one-on-one, so both parents would be a part of that process, or would it be individual?
Yeah, so if it's a couple, we encourage them to do one-on-one with their own therapist.
Okay.
So that, like, you know, if you're the mom, you're like, oh God, get him away from me.
Yes.
I just, you know, he's the problem, right?
Right.
So they have their own space,
Right.
and then we do bring them in for marriage counseling,
Okay.
yeah, together with the therapist.
Okay.
We have a question online.
Yeah.
What suggestions do you have, Sheng, for providers to learn more about cultures of their patients or members and to become culturally competent?
Well, that's a loaded question, right? So I always say, yes, you can go to trainings. You know, I do a lot of trainings. We do a lot of trainings, but here's the truth. Trainings don't actually work, right? A lot of times you're just forced to go and do it. You have to want to do the work. And so if this person online is looking for like ways to improve cultural competency, culture looks very different in all of us, as I mentioned in that slide. Ask your patients, because culture is not about what someone looks like, or they may say they're Hmong, or, you know, they may say they're Latino, but, you know, we have to consider their migration history. Are they first generation, second generation, right? Their language skills. And so I never want to say that we're ever culturally competent, because people are so different. Best thing to do is ask the person and the patients in front of you. Now, there's also a lot of rich resources in our community that's willing to provide you with that culture-specific knowledge. You as an individual have to be humble enough to walk in there and ask, right?
Now, Sheng, one thing that I think some people are afraid of is asking too much or burdening people of marginalized communities with their questions, right? So like, you know, I don't want my ignorance to become, you know, your task or your job. How do we balance that as a person with privilege?
Yeah, absolutely. So I would say if you're working in an organization and there are people from, you know, different backgrounds within the organization, don't use them as your token because, you know, I have that Black friend or I have that Hmong friend. Again, there's a lot of culture-specific organizations here in the Fox Cities now where you can call and say, hey, I'm, you know, this and this, and I'm wondering, is this a service that you provide, right? And if they do go there, I'm just thinking about, there's the, you know, prayer center that I know sometimes will offer anybody to kind of call and just really understand the, you know, the Muslim culture and all of those pieces, right? And so best thing to do is, again, realizing that we are rich with resources here in the Fox Cities, especially culture-specific organizations. If this person is looking for resources, definitely feel free to give me a call and I can kind of guide you in the right direction. Other questions?
I forgot if you said this at the beginning, but I was just curious what you and your husband were doing prior to this.
Yeah, so my husband has a background in business finance. So for 15 years, he worked for a global organization doing global supply chain, procurement, business accounting. So nothing to do with nonprofit and health. And then I'm a licensed clinical social worker by trade. So I've worked in county systems. I ran a large hospital for a while. And then my latest role was I was a professor with UW Green Bay in their social work department. So I was doing that for 5 years in addition to running us to behavioral health care. I finally resigned in August because I'm working 2 full-time jobs. I was like, okay, can't do this anymore. But I will continue to add to.
So you're not busy.
I'm busy, but I'm really, you know, you're really passionate about what you do. It's not work. And then the best part is I have 2 young girls. And the best part is when they're proud of their mother and you are able to teach them anti-hate, right?
Your girls group,
Yeah.
how do you get girls for that group? Or where are those girls coming from?
Yeah, so definitely usually they start with our one-on-one services, and then we let them know, hey, this is a group that we have. And so if you have anyone who may be interested, this is our pilot, and it actually was really successful that we had to close it. And so we are looking at having another one, just because of the responses we've had from parents, the kids, or the girls themselves, and then also the referrals.
Okay, I was gonna say, do you take referrals from
Absolutely.
other organizations or
Oh.
agencies?
Yeah, and our clients actually don't need a referral to come.
Oh,
They can call. I know some organizations require, a fancy doctor or another organization to make the referral. Those are barriers. I don't have time for that. Just call, and if you have a hard time calling, your client has a hard time calling, you can call with them. I mean, we have text messaging, we have online where you can go on our website and fill out a portal form, and we can get you in. Yeah.
Are all the schools, like the Appleton Public Schools is the one I'm most connected to on
Yeah.
fluency and attendance issue. But are all the schools aware of your services?
So in the Appleton School District, we're only in the elementary schools right now. Yep, so we're in 8 elementary schools, and then in Neenah, we are in all of Neenah School District. We started with Neenah in the 2021 school year, and since we've been in, despite COVID, their numbers and trends in terms of self-harm and hospitalizations have actually gone down from their previous partner who was pre-COVID. So we're really proud of that.
I'm thinking of being in the school, I'm thinking of making sure that the school counselors, psychologists, and social workers are aware of your services.
Yes, I would think so, because we do have a relationship with that connection with the administration team, and then within the elementary schools that we're in as well, right? So there's a lot of communication. I don't know how much, I guess, they share about our resources at the middle schools or high school, but I would think they do, like I said, just because we do have that relationship.
So, one question with the school base, do you meet at the schools or do you have the students come to your office?
We go to the schools.
Okay.
Yeah. We go to the schools. Last year, we wrapped up the school year doing about like 2,500 sessions in the schools with a team of 5 between both Appleton and Neenah. This year, we're projected kind of around the same time, and we go right to the schools.
Okay.
Jack first, sorry, you can go first, sir.
Okay, thank you. First of all, congratulations. I'm very enthralled with your courage and your mindfulness to carry this message, because nobody wants to talk about it. And I'm just an old white guy that grew up in a certain way, and I'm still learning. And my trade was building, fixing things, and now I'm working on people because I'm in the substance use and mental health field. And the substance use and mental health doesn't discriminate, no matter where you came from, who you are. The thing that perplexes me is the fact that people be able to get together and communicate with enough passion and mindfulness to listen and agree to disagree. But we know from the kids growing up, my wife was a teacher for 31 years, and I saw stuff that just totally bothers me. We need to get back to what we were created to be here. And I was just talking to Mike earlier, I mean, the Valley has a plethora of resources, but unfortunately, it's not who you are, it's who you know to get those resources. It's wrong. It's totally wrong. Capitalism, whatever you want to call it. But yeah, the white man has had too much power and control and got it in very inappropriate ways. So how do we continue? We go out there as peer supports and coaches to offer support and resources to people that have lost their way, and the pandemic just brought everything to a head. So how do we continue? The multicultural center is it's a God thing, as far as I'm concerned. Sorry if you don't believe in God, but I do. And with that power and people like you and other people standing up for what they believe in, but the part that bothers me is too, because people are so power hungry and greedy, they won't listen. If they're not gonna have an intelligent conversation, why are you even here? You need to sit down and have the tough conversations. So you just gave me another ray of hope to build on my passion as an old guy. Reach out. People say to me, why do you even do it? I said, why did somebody 36 and a half years come to me and say, you don't have to live like this and plant the seed. So thank you for planting the seed that continue to do what you do.
So power, right? And I love having a conversation about power. I know usually when we talk about power, people think about power, they think of like dictatorship and how bad it is, but power is actually not bad. Some of us have more power than the others based on our structures and our systems and how we were born and all of those pieces, but we all have power. We may not, I myself may not have a lot of power compared to maybe someone who is, you know, wealthy, white male, right? But all of us in this room have power, right? And we've been able to make change through history, through collectivism and mobilizing our power. But there are still folks who have so much power, they literally choose not to do with that, anything with that because they can live complicitly.
Ma'am, do you still have a question?
Yeah, I would really like that. I work for the governor's office and, you know, that's just like one place of power, but that's one thing that I talk about all the time when my job is regional and I'm meeting, like this morning I went with a nonprofit. They knew you actually, the people at the meeting. And because I was saying where I was going next, but I mean, I talk about that a lot with folks. It's like every single individual or group, they do have a lot of power that they don't realize. And sometimes they just need a little bit of help and guide them how to use it.
Yeah.
But my question was, like with the schools, how does that process work for students to be referred? Or what is the process in both of those school districts?
Yeah, so typically, so anybody can really do a self-referral, like I said. Most of the time, the school counselors or the teachers will say to, you know, little Bob's mom, hey, you know, there's a service and, you know, this is how you can call and get connected. And so kind of different ways, sometimes they send home flyers and brochures and the parents call us. But I would say about 90% of the time, it's, you know, teachers and school counselors that are making that referral. Yeah. You know, and one thing I will add to what you said too, I think you over here talked about like being educated or that I'm educated, right? And I would say that in itself is power. And one thing I've learned, if people say, how did you get to where you are now? I had the privilege of having a father who was highly educated for where he came from and really believed in education, because education is the one thing that no one can ever take away from you, right? You can take away everything, you cannot take away my education. And what I've learned about power and education though is that if I wanted to get anywhere in life and if I wanted to do better for myself in Black and brown bodies, I had to get educated and I had to think and speak like white people, because you cannot disrupt any system, right? Looking different.
We have time for one more question. Okay, well then I will, if there's nobody, I will steal that question. I'm gonna ask, we know that we're in a mental health crisis as a country, but also as a local community. What are you seeing in your clinics? What are you seeing from people, especially from, you know, those Black and brown people who might be experiencing the worst effects?
Yeah. Well, okay, so we keep talking about this uptick in mental health needs, right? And definitely there is, right? I will say this about the increase in mental health needs though. There's two things, right? COVID is not the problem. COVID is not the root cause of it. Our system, right? Our infrastructure loaded the gun. COVID pulled the trigger. Okay, so Black and brown bodies, why did we see an uptick? What did we do? When we take our already underinvested mental health system and add that, right, to social isolation, add that to hate, you add that to a virus that's coming by and killing all of us, we're going to get an uptick in mental health, right? Because it's about, what about me? What's going to happen with me, right? Life as I knew it, people that I knew, right, are dying, right? We have a stress where we're exposed to the trauma of COVID happening quickly, and then we have compounded stress. We have secondary stress as a result of COVID and everything around us.
All right, let's give another
Thank
round
you.
of applause. All right, our next meeting will be virtual on March 28th and we're gonna have Hillary Haskell from Hope and Help Together sharing, okay? So thank you all for coming online and in person. We always love seeing you. Have a wonderful day, and we'll see you in March.
Kyle.